Once a patient has had a weight loss operation, it is extremely important that they come back for regular follow-up, particularly in the first 1 to 2 years after surgery. We provide very strict regular follow-up for patients, and this involves the surgeon as well as our multidisciplinary team, including our nurse, our dietitian, and our exercise physiology team. It is important to follow up patients so they don't have issues after the surgery in terms of their ability to eat, that they're getting enough nutrients in and enough calories in.
Surgery is only the beginning. Weight loss and maintenance of weight loss is something that we need to continue to work on for the rest of our lives. At Lap Surgery Australia, we believe long-term follow-up is necessary to ensure that the weight loss is maintained, that the dietary education and counselling continues, and that any nutritional deficiencies are monitored for and treated appropriately. Weight loss surgery is a lifelong commitment because obesity is a chronic disease. The surgery is only the beginning. It requires a lifetime of commitment to good eating behaviours, healthy lifestyles to ensure that the weight loss that they have achieved is maintained.
Weight loss surgery is a long-term commitment, so that lifelong follow-up is important. We do see from evidence that while the surgery is very effective, there will be a proportion of patients who will have some degree of weight regain over time, particularly without follow-up. So it is important that we follow up our patients to help them reach their goals and maintain their success in the long term. We encourage our patients to come back and see us initially every 3 to 6 months, in the long term and for lifelong, potentially every year for the rest of their life, to follow up on their success in terms of their weight loss, to rule out any surgical complication, but also to make sure they don't fall into trouble with vitamin deficiency or other issues. The long-term follow-up of our patients allows us to achieve the best results for them. This means that we follow them up in terms of their weight. If patients have some degree of weight regain, we can address those issues before it becomes a bigger problem. This can be done through our weight regain clinic, where we have a number of physicians who can consult with them. We can look at different treatment options for weight regain. We have dietitians. The physicians can look at medication as well. And there can be potential surgical options for those patients.